St. Francis offers a new alternative to open heart surgery.
So what TMVR is ideal for is the patient who's so-called prohibitive risk for surgery, a patient who's the surgeon may evaluate and feels too high risk to undergo open heart surgery to replace or repair the valve.
TMVR is transcatheter mitral valve repair. So it is a minimally invasive technique for repairing leaky mitral valves in the heart.
The TMVR program is a newer program. We've been doing it within the past 3 to 4 months, and patients have done excellent. And I think building that on the back of the TAVR program has been very beneficial. Patients notice a difference right away. Even in the hospital, they can feel better. And with it being minimally invasive, the recovery process is very quick. Typically within a week, they're back to doing everything they were doing before, only feeling better and breathing better.
St. Francis Healthcare, called to serve you.